My name is Hayley Burgoyne and I work as the social prescribing facilitator for St Austell Healthcare, who is a big GP practice in St Austell in Cornwall. We have around 31,000 patients, so we are a really big practice trying to support our patients. So social prescribing is a way of linking primary care patients to appropriate sources of non-medical support in the community, and these support options are often delivered by the community and voluntary sector. So our aim is to try to signpost patients to appropriate help and activities to empower them to take control of their own health and well-being and hopefully improve their well-being long term. A lot of patients come to see the GPs. Some of them come for medical reasons, but often they'll come for social or lifestyle reasons. So the GPs know that they might not be the best experts to know where to send these patients to. So social prescribing can help alleviate the GPs and give them another sources of referral so that they can say, oh, actually, we know that social prescribing can maybe help you to get fit or to lose weight or to improve your mental health. We've got somebody that can actually support you in these sort of non-medical ways. The benefits are multiple. I mean, I think at the end of the day, it's all about the patients. It's about improving them and helping them. So the benefits are, that we've improved their well-being, we've improved their confidence, we've reduced a lot of patients taking medication, getting into work and volunteering. So the benefits to the community is great, but obviously also to primary care to sort of reduce the demand on primary care. When we looked at the demographics of our referrals, we do have more sort of people of the ages between 50 to 70. So I think we did help that cohort more. But saying that, we've got patients anywhere from 18 to 88. So it's quite a diverse range. And as we're moving the social prescribing forwards, we are trying to be quite preventative and try to help the younger population as well. When we ran our pilot, we ran a physical activity pilot. So we tended to get a lot of patients either with mobility issues, with diabetes, with weight management problems. So we did have a lot of those types of patients, but actually it can benefit anybody. And now we're starting to see a lot of patients with mental health problems coming to the social prescribing. So it's quite broad and diverse. I think we were quite lucky here at St Austell Healthcare because our clinicians are very forward thinking and open to it. But it is a change. It's a change from the traditional medical model. So, I mean, you're obviously going to have a few teething problems when you start something like this. But I think it's gone very well for us. But obviously the traditional worries are about changing the way people think, but also funding, to try and get something like this off the ground and keeping it going. So we've got funding issues, capacity issues, obviously with demand, which is not a bad thing because you want to have the demand, but at the same time you want to have enough help to be able to help the patients quickly. So I think those are some of the challenges that we experienced. The patients have been really happy with the service because they've been offered something different, and it's an additional service. We're not replacing, the general practice. We're actually saying this is an additional offer. We can help you in a different way, and we're actually giving those patients time. So our first consultation is a whole hour, up to an hour. So they've actually got time to speak to us, and we're asking the patients what matters to them, and we've got time to help them. So I mean, we've had such good report backs from patients really appreciating the time that we've spent with them. So we do our own internal evaluations at the moment by monitoring obviously how many patients come into the service, how many complete the 6 months. We take a wellbeing questionnaire, so we look at their wellbeing before and after the intervention. We look at their physical activity levels. We've also done, with the weight management patients, we look at their body mass index, and we've had about 70% of our patients have actually lost weight through the program. We've had 77% of patients improving their wellbeing. We're also trying to look at sort of GP appointments to see, and we've proven that it's reduced the GP appointments for these patients. And long term, we want to look at things like secondary care, so admissions to hospital, so that the options are endless with regards to research going forwards. So many fantastic support options for patients, and it's about really finding those options. My background's in health promotion, so our lifestyle directory is really comprehensive. So with regards to weight management and physical activity, we have everything from very gentle chair-based exercise classes like chair-based Zumba, chair-based yoga. Then we have things like horticultural therapy, so gardening groups. I run a Walking for Health scheme, so we have walks walks all over the area. We have dance classes, Zumba, yoga, circuit training, swimming groups, also exercise referral in the gyms. So there's so many physical activity options, but then there's also weight management options, cooking courses. We've got diabetes support groups, mental health support groups, all sorts of, singing classes, all sorts of things that people can get involved in. It's about finding out what is there. So, and meeting the providers and finding out what they provide, and obviously if they were happy to take part. But everybody's been really, really open to it, because we've obviously increasing the referrals to these organisations, and also some of even the private organisations, we're actually helping them to actually get, to get new clients, new punters for their services. So it's worked. I think it's sort of like working in partnership, working two ways, so we're supporting each other. We've already helped with the Department of Health Social Prescribing Fund, so we've got 8 link workers around Cornwall, and with the new GP contract we're hoping to have a link worker with every population of 30 to 50,000. So in 4 years' time I would like to see a really network of social prescribers all over the country, all helping patients.
My name is Vanetta and I live in the area, and I'm a patient here at Wheel Northey Surgery in St Austell, and this is where I came for my appointment when I was diagnosed as a pre-diabetic. I saw on the screen in the waiting room, Diabetic Walks at Eden, and I thought, this sounds like something that I'd like to take part in. So after a couple of months, I was actually regularly walking on the walks. When you're offered all kinds of ideas and suggestions about what you can do to change it all around, then you grasp it with both hands. And I went on a 12-week healthy eating course. I became involved in over 55's activities, doing circuit training at a gym, which I never thought I would do. And just the general encouragement and the regular checks and appointments made such a difference. And I have to say that it was a very long time before I went back and had an actual doctor's appointment. If you look at your situation, you can actually see that you can do something about it yourself. And also because the medical system at the moment is so overloaded with so many patients that people really do need, I feel, to take responsibility for their own health in so many ways. I think the general support from social prescribing has been a huge part of it. I interviewed 10 people. Well, I was one of them, so I interviewed 9. And so they told their stories, and it was all documented, yes, just to give this picture of success, that if you work at this, if you put your heart and soul into it, it can make a difference. Now, I have to say that I think probably everyone, without exception, that I spoke to, they have perhaps ticked along with their diagnosis until they came across social prescribing. And that, I think, in virtually every case was the turning point for all of the people I interviewed for it. And suddenly it was almost like someone had turned a light on and things were going to change, and it gave them hope. And all the people that I interviewed, and that was at the beginning of 2018, they all walked regularly with the group. And so through that, we formed a support group, and those people became the basis of the support group and a buddy system for helping and inspiring others. We do food tasting about once every month or 6 weeks, and that is really led again by the same group of people, just giving ideas of diabetic friendly food, sort of low carb, sugar-free foods, and it has worked really, really well, and they've been a good inspiration, as it says, 10 inspirational stories. They've been exactly that for other people.